Hello, you guys. Welcome to today's webinar on cat health and nutrition. This is Dr. Jones. First, thanks for being here. And I'm just going to hop into the chat room. Just want to make sure before I say anything, I can be heard. Yay. Okay. So feel free to type something into the chat box. And I see a few people have already. Hello. Hi, Marianne and Juliet and Ren and Joshua and someone I saw Alaska, someone Turkey. Well, hello. Hi from the UK, Calgary, New Hampshire. Andrew can hear me. Ontario, Pittsburgh. Okay, you guys are from all over. Indiana. Let's see, Missouri, Maple Falls, Virginia, Australia. Wow, California, Mojave Desert, Toronto, Texas, Lethbridge. Okay, and you can hear me well. Even better. That's awesome. And you guys from all over. Wow. North Carolina, New Orleans, a bunch of wonderful places I'd love to visit. The Austin, Texas, Washington State, Wyoming, Oregon, Wisconsin, somebody else from Austin, a Canadian in Southern California. I suspect it's warmer there than it is here. Let's see, Quebec, Malaysia, wow. California, Maryland, Driftwood, Texas. I lived somewhere in Driftwood, northern BC. Colorado, Pennsylvania, Toronto, Rio de Janeiro, Brazil. Oh, hello, Laura from Brazil. Let's see, Staten Island, Detroit. You guys are New York City. Wow. Dominican. You guys are from all over. Wow. Thanks for the vids. You're welcome, Jason. Thanks for being here. Okay, you guys, thanks for being here. Looks like there's Big Island of Hawaii, Puerto Rico, Vancouver. Yay, someone from BC. Hi, Catherine. Let's see. I'm the best. Thank you. Barbara from Miami. First, thanks for being here, you guys. I'm going to get going. Hi from Montreal. Someone asked how to enlarge the screen. I think it's easy enough to do. And I think because I've got my settings so the screen is fully enlarged. So you should be able to click a button in some section and have the screen enlarged for you. But I've got it, I think, about as enlarged as I can get it. I'm just making sure it is. Yeah, it's fully enlarged. Yay. Oh, I see someone's even from Pakistan. Hello, welcome. Thanks for being here. So let's just get going with the webinar. It's about how to keep your cat healthy with food and at-home remedies. And we're going into some big details about some of the more common cat diseases, in particular kidney disease in our cats, as well as urinary tract disease. As I said, we're covering a bunch of stuff, and I've even added more slides. I tried to cut stuff out, which I cut some things out, but I'm like, oh, I got to mention this. I got to tell this. So you're getting an information pack webinar. Try to be as focused as possible. And the other thing, which I always say in the presentations, just try to take out like 3 to 5 things. That's it from the presentation. You don't need to remember everything. You're going to get a recording of it. But 3 to 5 things like, oh, I might do this different with my cat, or maybe my cat's got this condition. I'm going to try this remedy, such as honey then I'm just going to slightly segue, but I was listening to a program yesterday on the radio, and they were talking about the effectiveness of alternative remedies, in particular when people have colds and flu. And the one thing that even the very conventional physicians did was that there was so much research, for instance, pointing towards the positive benefits of honey. Not only that, also showing that the honey was more effective than any of the conventional cough medications that we typically use, such as dextromethorphan, which is like, so it's just great to start to hear this in the conventional world as well. But be as focused as possible. A bit about me, for those of you who don't know me, I was born and raised in a farm in Lillooet, British Columbia, Canada. And as I put in this saying here I am, the young and styling Dr. Andrew, with one of our cats, originally named Beauty. I suspect my brother and I named her Beauty. I graduated in 1992 from the University of Saskatchewan with my DVM. I practiced for nearly 20 years as a small animal veterinarian. Mostly, I did some mixed animal practice. And since I really started to focus on alternative and non-traditional remedies, since then, I've authored numerous digital books. We have a regular newsletter, numerous articles, created a home study course, hundreds of videos, And even since that time, we've developed complete nutritional supplements for dogs and yes, for cats. I was featured on ABC's News Show 2020, fairly controversial at the time. You could Google that 2020 and ta-da, there I am speaking. That was a few years ago. I suspect my hair was less gray then. I released my first quote unquote real book called Veterinary Secrets on Amazon in 2014. Really happy to see it go on to become a #1 bestseller. And perennially on the webinars, I say I am working on the second edition, and I am working on the second edition. It's just I keep learning new information, like, oh, I got to add that in. But I think somewhere in there, I've just got to compile all the best information I have, release the second edition. Currently, we have the largest natural pet health and wellness channel on YouTube with now over 660,000 subscribers. I'd love for you to become a subscriber, but do so after the presentation. And we're also on many other social media channels. In particular, now we're on TikTok, which is almost up to 500,000 followers, which is awesome. If you're on such a thing, and here we're just posting really short, informative videos generally. So it's much the same things on YouTube, just much shorter and informative. So let's get right into it. I mean, who do you ask about what is best and what is best to feed your cat? Right? And this comes from a well-respected feline veterinarian, Dr. Lisa Pearson, saying, unfortunately, many veterinarians are not the best source of nutritional advice for your cat. And I 100% buy into exactly what she's saying here. You're putting a little bit of thought into what you feed your cats can pay huge dividends over their lifetime and very possibly help them avoid serious, painful, life-threatening, costly illness. And no question, there are an increasing number of nutrition-savvy veterinarians, and they're strongly recommending against feeding dry kibble, only feeding canned food, species-appropriate food. However, yet still, many, if not majority of veterinarians are still condoning the feeding of dry foods to cats, right? It's easy, super convenient, what we've been doing for 50 or 60 or 70 years. Unfortunately, and I've said the same thing, and I 100% subscribe to the same belief that, like medical doctors, physicians, veterinarians receive very little training in school regarding nutrition. And often what is taught, and I had that exact same experience, in part came from the pet food company representatives. Right? That's where we're getting some of our CE from. And they're providing funds to some of the programs, ultimately really because of that, influencing what was being taught, right? And really it's representing a significant conflict of interest, right? How could you not be somewhat biased? Like, oh, I don't want to say that horrible thing about this new Hill's pet food because I may not get funding for that. And you'd like to think that's not happening, but even subconsciously, it's hard not to be biased. Like even the most ethical person can't help but being somewhat influenced. If your funding is directly correlated with, this pet food company. Ultimately, our goal should be to feed a diet that nature intended for our cats or carnivores. Staying as close and formed to what they would eat in the wild, not dry kibble, but water, protein-rich food, canned, homemade, or raw. And if you take anything away from this presentation, that's all you need to take, right? Stop feeding dry kibble. Some of the common medical problems associated with dry food: asthma, diabetes, kidney disease, liver disease, urinary tract disease, inflammatory bowel disease, right? Obesity, dental disease. So many things directly correlated to diet, in particular the dry food. Also, many people aren't aware that some of the dry foods are often also contaminated with bacteria, storage mites, and even can be dangerous and life-threatening mold spores. Many times this is making cats sick more often than many people realize. I mean, how can these foods keep that long? So let's just talk a little bit about the unique metabolism of our cats and why carbs can be harmful for them. Although cats, they can use carbs as an energy source, they have no need for them. And they've evolved by hunting other animals. They were high protein, moderate fat, minimal to no carbohydrates. And they're designed for high protein metabolism, low carb metabolism. Right? Cats lack certain enzymes, such as an an enzyme called salivary amylase. Further evidence they're not designed to digest carbohydrates. They have only 5% of the pancreatic amylase, 10% of the intestinal amylase of dogs. I mean, these are enzymes used to break down carbohydrates. They don't have the same enzymes. And cats in particular get far more of their energy from protein than most species. They have this really short colon. It doesn't work. It's not designed to break down starches and fibers through bacterial fermentation. Kind of like what happens in a horse, for instance. They're not horses. They're not eating grass. They're designed to eat animal protein. They lack other enzymes, such as the liver enzyme glucokinase, and this is used to break down blood sugar. So say your cat eats a high-carb meal, either a kibble, his blood sugar spikes, but he lacks the ability to rapidly break it down. So what does that do? I mean, that can overwhelm the pancreas, making it more difficult for the pancreas to produce enough insulin. Or in other cases, you got too much sugar going around. The cells no longer respond to the insulin. I got smart this time and I have something to drink. It's actually a dandelion. Aren't I being healthy? It's a dandelion type sort of tea. Exactly how to choose a quality cat food. So most cats are fed dry kibble with no water, predisposing your cat to urinary disease, kidney disease. Foods with too high of a carbohydrate level, predisposing them to obesity, diabetes, arthritis. And often the wrong type of protein. Often it could be like a plant protein, i.e. soy, and often that protein is just at too low of a level. Right? So if you're going to look at foods, look at the top 5 ingredients. They make up, for instance, 70% more of a pet food's entire formula. I even put dry pet food. And really, you probably shouldn't be looking at it, but if you're looking at the ingredient list, regardless, look at the top 5 ingredients. And clearly the first ingredient is most important because they have to list foods in order of weight. Obviously, you want to have an animal-based protein first. But that being said, the pet food manufacturers, they can play around with that. So they can make it look like an animal protein is first, whereas in reality, it's not. For instance, when they're formulating food, say on a dry matter basis, they might start out with a whole chicken and then everything else is just corn and barley, et cetera, after the fact. But when they dry that out, they remove all the moisture. Say the chicken was 80 or 90% water. When they dry it out, in reality, the chicken is going to be 3rd or 4th on the ingredient list. But because they got to weigh it first before it was dried out, they can say it was first on the ingredient list. So anytime you see a relatively inexpensive, supposedly quality food, you need to think twice about that. And know that sometimes they're not being 100% factual. Look for the first name source of fat. So anything listed, including the fat, and before that, make up the main portion of the food. Obviously, you want to support companies that have a good track record of producing healthy food. They have good quality control, right? And show that their food is nutritionally sound. And what does make a good cat food? Simple, more than anything else. It's much the same way you probably should be eating. I'm trying to eat myself, and many of us should probably be eating. Like, what would you feed this little cute kitten who's super cute? Real meat, such as chicken, right? Lamb, beef, bison, deer, fish is the primary ingredient. Sources of high quality, highly digestible protein. And think about what a cat would eat in the wild. Lots of protein and fat. Virtually no carbohydrates. In adult cats, they need 29% protein versus 12% in dogs, and minimal to no carbohydrates. Other essential plant nutrients, antioxidants, natural vitamins, and minerals. Many of the quality cat foods, they're going to list sources of fat that provide the proper balance of the omega-6 fatty acids, the less beneficial ones, to the omega-3 fatty acids, the more beneficial essential fatty acids. Ideally, you want about a 2-to-1, 3-to-1 ratio, not the 15-to-1 ratio typically found. It can lead to things, make it more likely your cat can get cancer, heart disease, autoimmune, and skin disease. So the ideal food, really simple, can be canned, homemade, or raw cat food. High protein, low carbs, moderate to high fat, high moisture, content. Like, ideal. Like, there it is. Okay, so the webinar is done. We can go home now. And honestly, though, like, tongue in cheek, if that's the one thing you did more than anything else, especially if you're starting out with a young kitten, and when I do get a kitten again, that's what he's starting on. He's not going to see any dry kibble. Concerned about toxic flea medications. All right, so when I want to talk about some of the alternatives, cedarwood oil spray, I've talked about it many times. It's an essential oil, and it's probably one of the ones that's got the proven to have the best results as being an insect repellent. You need to be super cautious spraying any type of essential oil on your cat. You want to be lightly misting them and using a flea comb to spread it around. The other big thing, if it is any type of essential oil spray, it needs to be 2% or less dilution. So you're not just spraying on 100% cedarwood oil. It's going to be in a specific spray that ensure, and it has to be at 2% or less to be safe for your cat. Taking humidity out of the air, right? If you take away the humidity, flea eggs, they need 75% humidity to hatch. The larvae need 50% humidity to survive. In dry areas with low humidity, less than 5% of the eggs survive. So part of flea control is controlling that whole flea life cycle. You can deal with 1 to 2 fleas. You can get a flea comb, take those off your cat. You can use one of the natural, say, shampoos, for instance. One of the pyrethrum-based shampoos is fine to treat the fleas. And then use a dehumidifier if it's humid in your house to decrease the level of humidity, breaking down the flea life cycle. Lots of people use diatomaceous earth, also known as chinchilla dust. This looks like this fine white powder, right? You get it out of the ground, looks more like a mineral, and it's from the skeletons of microscopic algae, right? You can apply it weekly during the flea season, putting it in the cracks and crevices in your house. And some people also lightly mist their cat with it as well, using a flea comb to spread it through. It also makes a really good natural dewormer. So if your cat grooms himself, that is okay with the diatomaceous earth. I've used it myself too. It tastes kind of pasty, but it seems to work. Interesting thing about catnip, researchers have found that one of the oils isolated from catnip called impetolactone, and it gives catnip that its sort of specific catnip odor. It's about 10 times more effective at repelling mosquitoes than DEET, right? So maybe that's why cats partly like to roll in it. It can act as like a flea and other insect repellent, which is huge. So get more catnip in your house. Neem oil. It's a carrier oil extracted. It's extracted from the neem tree. It's native to Southeast Asia, right? So one of the things I like about it is you can use it in a mixture of, and I've got this one sample spray here where I use neem oil diluted once again. So you've got 2 cc's, a teeny amount of neem oil, 2 droppers full in 250 mils or 1 cup of nettle tea, shaking that up well. And it's been another one of the oils that's been so well documented to be a natural insect repellent. Right? It's got a number of other different specific properties, but especially being such a powerful insecticide. And in many areas, there was an option. But here's another sort of idea if you wanted to make your own natural flea spray. The one thing about neem, I just want to add in, it definitely has a pretty unique, strong odor. So yes, it's good at repelling critters, but it definitely has a bit of takes a little bit to get used to. So it'll be one of those things. You want to try something 100% natural, or you're looking for a product that includes neem? Yeah, I definitely recommend it as part of being a natural insecticide. But just know that it's got kind of a unique smell to it. Don't like all the vaccines. There's even some new information about vaccines that I wanted to share with you guys. So clearly, and over 30 years ago, this came out, right? Evidence saying we shouldn't be vaccinating early, at least 30 years ago. So what you need to do is be asking, and I say this with all vaccines, serious questions about the incidence of these diseases and the risk versus the reward. For example, the risk of your cat developing vaccine-induced sarcoma from the feline leukemia vaccine versus like the risk of getting feline leukemia versus how effective is that vaccine in the first place? Great question. Because I know for me, I would not be vaccinating my cat for feline leukemia virus. And for instance, veterinarians acknowledge that current suggestions, etc., do not really reflect the fact that challenge studies have shown a very long duration of immunity, lifelong for some diseases, from just a single properly timed vaccine. Because you can ask many veterinarians if they're being truthful. I'm like, well, I don't vaccinate my cat that much. I have an indoor cat. He's not getting any vaccines. Right. And in general, like for instance, almost 30 years ago, Colorado State University said we need to go to at least a 3-year vaccine protocol. Yet, for years and years, and it's still happening today, you got many vets still administering annual vaccines, which makes no sense. So in my opinion, I'm gonna get a little kitten, I'd vaccinate him for FVRCP, the 2 respiratory viruses, feline pan-luke. I do that at 8 and 12 weeks. Feline leukemia vaccine, honestly, I discourage you from getting it. I don't think it's a big benefit, and it's got an increased chance of producing side effects such as this vaccine-associated sarcoma or skin-related cancer. The rabies vaccine is different. In many states, it's required by law. But if you got a strictly indoor cat, no, why? Do not give your cat rabies vaccine. And the other big point is wait at least till 6 months. Like, don't give it in combination with those other vaccines. And some of the other, in my opinion, unnecessary or less clearly not effective vaccines, FIP, feline Bordetella, FIV, right? Limited to no use of feline leukemia vaccine. Then titers, honestly. Maybe even just do titers at a year of age. See what your cat's antibody levels are. They may need not any further vaccines. You got an indoor cat, in my opinion, your cat does not need any vaccines. And this, I wanted to add this slide in because here's one veterinarian. She gave her kitten, our cat has kitten, 1 booster. So 18 years later, she wanted to do antibody levels just to see what are the antibody levels for feline panleukopenia. Essentially, that's feline distemper. 18 years later, again, protective levels after only 1 vaccine. So point being, these vaccines likely last much, much longer than we're aware of or that we're told. And like, here's an example. It's ultimately up to you. You need to learn about as much as possible vaccines, diseases in your area. Obviously, it's not your veterinarian's decision. You need to be most informed because you're the one that gets to advocate and say yes or no. They can't force you to get those vaccines, right? And that's the other big thing, to take anything else from the webinar, is just being more assertive and clear. I mean, this is your cat, your cats, and ultimately your decision, not the veterinarian's decision to give that injection or not. A bit about supplements. Are they really necessary? Well, if you feed your cat a varied diet, some other good oils, and essential fatty acids in there, they may never need a supplement. But most of us don't do that, right? We're just kind of feeding what our cats will eat. And I am of the strong belief that the right supplements can help prevent many of the more common cat diseases. So you're looking in the aisle on what? So let's use your cat's immune system as an example. There are a number of specific ingredients I do advise clients use to help boost the immune system or support the immune system. The essential fatty acids, the good bacteria, the probiotics, antioxidants, zinc, flavonoids, selenium, colostrum. Some of the immune supportive mushrooms, lysine, which is antiviral, even aloe vera. My supplement, Ultimate Feline Health Formula, contains some of these immune supportive ingredients. The good bacteria, the probiotics, the antioxidants, zinc, selenium, colostrum. Immune supportive mushrooms, lysine, and aloe vera. This came from Dolores from the Philippines. She ordered Ultimate Feline Health Formula, and she's already witnessed that this product truly enhanced my cat's appetite. Her old guy was a finicky eating cat. She sprinkled the product on top of the food, and he eats with enthusiasm. Thanks, Dr. Jones. Thanks, Dolores. So part of today's special, we're having Ultimate Feline, the trial formula, for 70% off. It's only $9.97. No strings attached, no ongoing payment. The regular price being $32.97 plus shipping, plus you're not locked into anything. Plus, we also have our new economy size. It will give you 180 servings, so that's like a 6-month supply for one cat, which is an awesome deal. And for this special, we're having an extra special price, which is 60% discount compared to the regular jar pricing. You can offer for $79.97. And plus, if you order in the next 12 hours, you get 2 additional free bonuses. First, a digital copy of my best-selling book, Veterinary Secrets, plus a copy on my book, Home Diets for Pets. So after the presentation, you can go to thecatsupplement.com/special. Kidney failures and cats. You should be focused on this. So we're going to cover a lot of information here. Don't feel the need to take it all in, but I'm going to highlight some big things that you may or may not be aware of. So first of all, here's a great resource, felinecrf.org, especially for those of you who have a cat with kidney disease, because it's just so common. So first thing, it's called chronic kidney disease, meaning it's chronic and ongoing disease of the kidneys, right? Not kidney failure. Many people would interpret it as like the kidneys are about to quit working. It's an ongoing one, gradual deterioration taking place as the kidney function fails. And this can actually take some time, often years, in many cases, in my experience. Right? So the kidneys have 5 main functions, right? They're regulating fluid in the body, right? They conserve water. They regulate and filter and dispose of waste products. They regulate electrolytes moving in and out, sodium, potassium chloride, right? They stimulate red blood cell production, and they produce a hormone that helps control blood pressure. Those are the 5 main things our kidneys do. So when they're not working, those different functions to be affected. And we look, and there's stages of kidney failure. We've got up to stage 1, where there's up to, we first detect something's going on. And that could not be until there's 66% of the kidney not be functioning, right? And then each different stage, we see less percent of the kidney functioning. Then we can see as low as 25% to 10% to less than 10% when we're at stage 4. So most cats with CKD, they have changes in their kidneys it's known as chronic interstitial nephritis. Really, we've just got this inflammation and secondary scarring. Right, so imagine scar tissue within the kidneys. The kidneys can't filter the way they're supposed to, right? And essentially, think of the kidney as it's filtering the blood that's coming in. So it's filtering the waste products, it's supposed to dispose of the waste products, and then conserve the water, right? That's the biggest function and purpose of the kidney. When all those scar tissue is there, it can't do that. Interesting, we're saying about 10% of cats over the age of 10 are diagnosed with CKD, have some level of CKD, and 30% of cats over the age of 15. So it's affecting a huge number of cats, right? And as I said earlier, you see this inflammation and excessive scar tissue occurring, and the end result is a cycle of kidney damage, right? And it's normal for CKD not to be diagnosed until as much as 66% of function has been lost, if not more. So over 2/3. There is some earlier detections. IDEXX developed one called the SDMA test. A simple blood test may detect it sooner when there's less than when there's 40% of function is gone, as opposed to the 66%. It's looking for a specific amino acid breakdown product, right? And for many guys, they can imagine a long time can function really well on limited kidney function. And some cats are completely fine until 90% of the kidney is no longer functioning. So what are some of the biggest clinical signs many people would first see, right? Your cat's drinking more water, urinating more often, might be losing weight. In part, this could be a loss of muscle mass, because often the kidneys are losing protein. And as it advances, your cat may be weak due to anemia. You can see your cat wanting to eat less because it builds up these toxins in the bloodstream. And in the advanced cases, your cat's going to be dehydrated and just not want to eat at all. Right. And in some cases, it can affect blood pressure. And because of that, we have some cats actually go partially blind and affect their eyesight if there's an increase in blood pressure. So let's talk about the early stages. Stage 2, stage 3, right? This is sort of typical. We call it early CKD, right? And you get the two sort of toxins or parameters that we're measuring. One's called urea, one's called creatinine, right? And here's creatinine somewhere between 2.1 and 4.5. So, at this stage, we want to manage high phosphorus. That's one nutrient we know does the most damage to the kidneys. And we want to manage low potassium, low electrolytes. We want to make sure your cat doesn't have high blood pressure. We want to make sure they're not losing too much protein in their urine. And then we have stage 3 and stage 4, more advanced stages of kidney disease, right? And here we're kind of deal with this elevated toxin level more than anything else, right? So your cat doesn't feel so sick and they get some other secondary blood changes going on. So that's why important. We first figure out what stage of kidney failure your cat's at, and then treat the specific things that are most likely going on, that are making them feel the way they do. Right? So obviously you're starting with food, regardless, right? The one essential treatment for all cats, right? Yep, therapeutic kidney foods can be helpful, but here's an example of one which I don't recommend. Hill's KD, especially the dry kibble. Another big point, your cat needs to be eating, right? And so it's not just, you can eat this specific, the vet told me to eat this food. But if he doesn't eat, he can get really sick, developing a life-threatening liver disease called hepatic lipidosis. Right? It can just happen in a few days after not eating. So it's not as much, like he needs to eat first. Right? Yes, and most vets say is get him on an extra low protein diet, or typically that's what most people would say. Yet today, there are no studies showing that if you restrict protein, really restrict protein, it's going to prevent further deterioration of kidney function, which is interesting. In fact, there are some veterinary cat specialists now advising to not dramatically restrict protein early on. They're advising to maintain protein levels, maybe slightly lower, but really focus on restricting phosphorus, because this is the nutrient that is damaging the kidneys, which makes huge sense. So let's restrict the thing that's hurting the kidneys in the first place. So you're looking at the food, you got to decide. You want moderate protein level, about 32% protein with relatively low phosphorus. And I'm going to give you an example of some foods here. So ideally, you're going to want about 32, 35% protein. So here's a slide. I think one of these slides actually has a list of foods. So the whole thing about protein, right? And it really is debated. Some people, no, they got to go on low protein now. But in general, like we're looking at these therapeutic kidney diets with moderate to reasonably levels of protein, because our cats need protein for all the different functions going on throughout their body. Yes, we want to make sure they don't feel sick as a result of having elevated BUN and creatinine, because that's partly what's happening is they're filtering the waste products of protein metabolism. But if you really restrict protein, they lose muscle mass, the rest of their body doesn't function normally, and then they get sick in other ways. So you need to find this certain balance of about 35% protein. You do want to make sure you have moderate to lower sodium, right? We know these cats are prone to high blood pressure. And it is advisable to feed a lower sodium diet. So in general, you want a phosphorus level under 0.5%. Right? Protein level about 35%. Sodium 0.2% and less. So there's kind of like the three big things, right? And here's a slide. This is the one. I'm not going to go through all of it, but gives an example of some of the foods that are sort of around those certain levels that we just talked about. 35% protein, 0.5% phosphorus, 0.2% sodium. And that it's good. There's phosphorus, protein, sodium. So you can have a good one to look at some of these foods and see if those can work for your cat. And these are therapeutic kidney wet foods. Notice none of them are dry. And I'm just going to go back to this point around phosphorus, right? So, in the early stages of kidney disease, this is the single biggest mineral which is damaging the kidneys, right? It's going to speed up destruction of the remaining kidney cells, right? So we're feeding a diet lower in phosphorus. Next, we're going to consider adding in things that can bind phosphorus in the diet, so it's not damage to the kidneys. For instance, calcium. In ultimate feline, we have calcium added, we have no phosphorus. So some of that calcium in ultimate feline is going to bind phosphorus, helping marginally lower phosphorus, which makes huge sense. This is what often one we use in practice, aluminum hydroxide. It's a phosphorus binder. It's kind of odorless, tasteless. You sprinkle about 1/4 teaspoon daily into your cat's food, help bind the phosphorus. Calcium carbonate, Tums, which is essentially very similar to ground eggshell, which is also really just calcium carbonate. About 1/4 tablet per 10 pounds of body weight, once or twice daily, can help bind. So we're using calcium to bind the phosphorus. Here's a natural one. Here's this one called Exulent Calcium. It's just crushed eggshells, and it's done for you. You should obviously make your own crushed eggshell powder, but here's a simple one where it's already ground super fine, dried, ground fine, and easy for you then to add in. You're adding probably something similar, about an 1/8 or 1/16 of a teaspoon daily. This is another one called epichitin. We used to use this in practice. It's based on crushed shellfish. Right? It's got ingredients that not only help lower phosphorus, essentially based on the calcium level that's there, but also seems to help lower levels of urea creatinine. Right? So a lot of cats did really well in epichitin. The other thing, so we're talking about phosphorus. Next thing, we're talking about fluid, right? I mean, the big thing here, your cat needs to stay super hydrated. He can't concentrate his water as well, right? When he's filtering the blood, he can't concentrate the water. And honestly, you're making the switch to canned food, right? There's so much more moisture in canned, right? There's none in dry. Think of all the, and cats that eat canned food versus dry food, even cats that have dry food and fresh water, cats that eat canned food get way, way, way more moisture. 100%. So you need to make that switch to canned food, especially a cat with CKD. Learn how to give fluids to your cat at home. This is someone at home giving subcutaneous fluid to their cat. They've got an IV fluid bag, a drip set, an 18 or 20 gauge needle. Most cats tolerate it well. You're giving a small amount of fluid, say 100 to 125 mils of fluid, about 1/2 cup. And you're giving that just under your cat's skin in between the shoulder blades. Most guys, they just sit there and like, they're fine with it. I haven't mentioned this as much, but you should be aware of some of the B vitamins. They're particularly important for our cats with CKD because they're water soluble, meaning they're lost in the urine. Right? Their cat's not concentrating urine, your cat is urinating more often. They can help with appetite loss, anemia, right? And even non-anemic cats seem to feel and act better when given additional B vitamins. So it's a simple thing to do, and here's an easy, inexpensive way to do it, right? You can just here's a human formula called Joe's B Right. It contains all the B vitamins, including B9, which is especially important, and B12, which is especially important, right? General rule of thumb, you're giving about 1/10 of a human dose to a 10-pound cat, right? So it's like one tablet can last you 10 days. So small, inexpensive, easy way to help your cat with B vitamin supplementation. And in some cases, we're specifically looking at B12, and especially these cats become anemic because they're no longer producing enough red blood cells because they're in CKD. And here we're looking at suggested starting dose for oral vitamin B12 would be 5.5 milligram a day, or 500 micrograms. So many of these cats can get constipated, right? Because once again, they're losing fluid. It's not going into the colon to help them pass stool normally. So there's some simple things you can do to help your constipated cat. Adding in ground flax, canned pumpkin. Lots of cats really like canned pumpkin. It's really high in fiber. You can add in castor oil, 1/2 teaspoon, twice a day for a 10-pound cat. And there's one herb, slippery elm. I'm just going to show you a little bit about slippery elm. Oh, actually, I guess I'm not. So, and I'm going to mention more about slippery elm, I think, in a few more slides after this. The good bacteria, the probiotics, but azadil in particular was one which used to use a fair amount in practice. And part of the thought behind it is we're using these good bacteria. They're binding some of these uremic toxins, like some of this urea and creatinine. So your kidneys don't have to filter it, and it's not making its way into the blood, and your cat doesn't feel so nauseous. Right? Standard dose, 1 capsule per 10 pounds of body weight daily of the azadil. Famotidine or Pepsid, and lots of these guys, especially when we're starting to see advanced kidney disease, stage 3, stage 4, they just felt really sick. And they're partly feeling nauseous and blocky, so they won't eat. Many of them responded well to Pepsid. Standard dose, about a quarter of a tablet per 10 pounds of body weight twice daily. And lots of cats did really well on that. Then and this is a little bit discussion about this slippery elm herb, right? So I really like it for coughing. I really like it as a natural antacid, just anytime there's stomach upset, and as well as for constipation. And this is what we're using here for these cats with CKD. So a standard dose, you can get it as the powder in a capsule formation, 1 capsule a day for a 400 milligram capsule. You can open up the capsule, sprinkle it on your cat's food. If you won't eat it, fine. Just pop 1 capsule into him once a day. And the other thing about slippery elm is it's super safe, no real side effects, and potentially really beneficial. And lots of people that have cats with CKD are big advocates of using slippery elm. I also want to mention this metabolic acidosis. Your kidneys, there's things that go on in the body. The cells do things, right? Our cells metabolize stuff because they take food in, they produce energy. They do all the different cells have all these unique functions throughout the body. But as part of normal cellular metabolism, we can excrete things such as these ions. But the blood is kept at a generally very strict pH. And part of the way that happens is the kidneys will excrete excess acid. In CKD, kidney disease, they can't do that, right? So it's like, now what? So you can get a condition called metabolic acidosis, and that also make your cat feel blocky. So an easy way to help your cat is with this right here, potassium citrate, right? Most of these cats that have metabolic acidosis also have low potassium. So this is probably the simplest way to do it to help. So you can help increase one mineral that they're losing, potassium, as well as help deal with this more acidic blood, which makes them feel blocky, right? Potassium citrate. And they're just simply adding these small granules mixed into their food. This is most often what we use in practice. I want to mention this. We do talk about heart medication, some people specifically using it when there's too much protein being lost in the urine. So what happens, it's called proteinuria, where the kidneys are excreting all this excess protein. That can directly be a result of just the interstitial cystitis, the scar tissue that's there, the nephron, the functioning unit of the kidney isn't working so well. So some cases, like as vets wise, we can diagnose all these different conditions. We can diagnose high blood pressure. We can diagnose, there's a medication for that. And we can diagnose proteinuria. We can diagnose, et cetera, et cetera, et cetera. All those different related conditions we talked about that the kidneys, we diagnose and we can specifically treat. Other injectable medications, say for an animal that's especially anemic. So you can medically do that, but it doesn't always make sense. And for instance, you can use this drug benazepril, help decrease the amount of protein going into the urine, but it's not necessarily helping your cat. And I just want to make a point. Most cases, it's not helpful. Right? So it's also being particular about what you are and not giving your cat with CKD, because there's so many different options. So I hope that gives you a little bit better of an overview and helps you if you've got a cat with CKD, what more to focus on, like focusing on diet, focusing on the right things of diet in terms of the adequate levels of protein, reduced levels of phosphorus, reduced levels of sodium. Then other things you can add in to help some of the secondary changes. They stop eating, you can try with an antacid. You can try with slippery elm. I think your cat has got metabolic acidosis, get some potassium citrate, right? There's some easy things you can do at home to potentially help your cat without all these big fancy other conventional meds. Some arthritis in our cats, right? Maybe older cats or cats are living longer, especially our cats are slightly overweight. Guess what? They can have arthritis. It's increasingly common as our cats age, right? Slowly food has direct correlation with it. Here's an x-ray, looks like a knee. And sure enough, there's all this inflammation in the knee. We're looking at an arthritic knee. So start with a good joint support supplement like glucosamine, chondroitin, MSM are ones I really suggest, regardless whether it's my supplement or another one. But glucosamine and chondroitin in particular, 100 milligrams per 10 pounds daily of glucosamine, 50 milligrams per 10 pounds daily of chondroitin, 100 milligrams per 10 pounds daily of MSM. Essential fatty acids, omega-3 fatty acids, really important, especially in animals with arthritis. right? A great source for your cat is found in krill and or fish oil. Standard krill dose, about 500 milligrams per cat a daily, so standard amount. And many cats are doing really well on the krill oil. They don't like the capsule, break it open and drizzle it onto their food. Acupressure, it's an overlooked yet really effective option. And I'm going to show you a couple different points. So what we're doing is we're pressing over top of the acupuncture points, but we're using just our fingers over top of those points because we're obviously putting acupuncture needles in that area. So there's one here called the BL. I don't see if I have a slide showing. I don't. Sorry. One's called the BL60 KI 3-point, and it is in the back. You see the BL60 where my little, I don't know if you guys can see my pointer there, but right there, BL60. So that's in that webbing of tissue just in front of the Achilles tendon, right? So you're holding your thumb on the inside, your finger on the index finger on the outside. You hold them together 30 to 60 seconds, right? Some cats respond to that. And then the other one I wanted to mention was the GB29, GB30, which is, go back to here, it's right there. Well, it's hard to see GB29 and 30. If you lay your cat on the side, you can see this little bone sticking up just about where their hip would be. Just move their leg back and forth. There's a depression on either side of that bone. And the one in front is GB29, the one behind it is GB30. Just put your middle finger, your index finger right over top of in those depressions, hold that for 30 to 60 seconds. Do that. I say do that twice a day, do it for a week and see if it's beneficial or not. Those are two big points that I find are most effective for our cats. And if you can see a veterinary acupuncturist and your cat open to that, strongly encourage you to do so. Try CBD if you haven't yet, right? It's been extensively studied as natural anti-inflammatory, really helpful for pain control in our cats, right? And many cat parents are just finding it to be super helpful for their older arthritic cat. Looking at a dose about 3 milligrams per 10 pounds of body weight daily, that equates to 1 drop per day of my CBD supplement. Just let it lick it on your fingers. Right? It's easy to give. I want to mention DMSO. So it originally came out of pine trees, a byproduct of the paper manufacturing industry, and was first isolated in the mid-1800s by a Russian chemist. It's also found naturally occurring in garlic as one of the root's 70 plus sulfur compounds. It's got this kind of funny garlicky smell to it. It really just looks like this clear liquid. But the big thing about DMSO is it rapidly penetrates into the tissues. So you can put it directly on top, so your cat has a sore knee, right on top of his knee, it'll penetrate in. And or you can put some CBD on or a homeopathic such as Tromium on first, rub in the DMSO, just drop it on, and it'll help bring the CBD or the Tromium into that joint. Really good option. I found lots of cats respond well to DMSO. And it's inexpensive. Some of the things toxic to your cat that some people might not be aware of. A few things I want to mention. So tuna, right? Great. My cat, lots of tuna. A bit of tuna now and then seems okay. But the problem is that we've got high levels of mercury, especially, right? So too much tuna, it can lead to clinical mercury poisoning, and it has in our cats. So now and then, once a month, okay. Some of the fire retardant chemicals, some of the problems are high in fish, also high in house dust, like house dust mites. They can affect thyroid function. And we know there's a causal relationship between cat foods high in fish and cats that develop hyperthyroidism, which is like, So some of these chemicals are concentrating in fish, etc., and we're using them, fire retardant chemicals in the house that can directly affect your cat's hormone production, in particular, potentially making them hyperthyroid. And partly that makes sense to me why 40 years ago, I don't think anyone saw a cat with hyperthyroid. It's not just because we didn't recognize it, because I don't think it was really existing then. And now it's like this epidemic of hyperthyroid cats. Soy in cat food, right? It's a known disruptor of the thyroid gland and clearly has no logical place in cat food. Yet, if you add soy to your inexpensive food, you just up the protein level. In one study, soy that was identified in food, 60% of all tested cat foods had a level high enough to interfere with thyroid function. So we know it can affect your cat's thyroid gland. It shouldn't be in their food, but 60%. I mean, that's way too, and It should be 0%. Some of the medications, non-steroidal anti-inflammatory toxicity. Cats cannot take ibuprofen, ibuprofen, for instance, naproxen, aspirin, Metacam, etc. Yes, many of you probably have had your cat on, for instance, say Metacam. One-time dose, okay. Some of the other ones, ibuprofen, seriously toxic to cats. Aleve, naproxen, seriously toxic to cats. Aspirin, occasionally a teeny amount of aspirin can be given, say, for a cat that has had a saddle thrombus, a type of blood clot. But it has to be marginal amount, very controlled, every third day. Our cats are so sensitive to non-steroidal anti-inflammatory drugs, right? Vomiting, diarrhea, liver disease, kidney disease. Tylenol, right? One 500 milligram tablet, seriously toxic to most cats, right? It can affect their liver, secondary affect their red blood cells. They're called methemoglobinemia, right? They never can ever get any Tylenol. The new Pepto-Bismol, cane salicylate, supposed to be great for diarrhea for people, but the problem is that can be seriously toxic to cats, causing vomiting, diarrhea, liver, and kidney disease, right? So there's a bunch of things that we think are okay, but not at all. Never give it to our cats. And lastly, lilies. We got tiger lily, day lily, Easter lily. We got lilies galore right now because it's getting near Christmas. But just small ingestions, 2 or 3 petals. They said even the water from the vase can result in severe acute kidney failure. So if you have cats, you don't want to have lilies. Let's talk about cat UTIs, right? So do you need the expensive prescription food or some holistic solution to help stop your cat's urinary tract infection? So I think we're doing pretty good for time. Thanks, you guys. Feline lower urinary tract disease. This is the other big thing I wanted to really talk about. You have a cat that's frequently urinating, straining to urinate. He or she's going to maybe excessively living their genitals. Sometimes they're going to urinate outside of the box. And I just want to mention that what Dr. Lisa Pearson's diet at catinfo.org is super helpful. It's idiopathic because we really don't know what the underlying cause is. We do know there's inflammation in the bladder lining is thickened, and there's resulting blood in the urine. But here's some interesting things. We're going to get to it. Some may be related to diet, maybe bacteria or viruses. The immune system may be overreacting, attacking the lining of the bladder. Simply can be a response to stress, right? Such as having another cat in the house. Not even letting your cat go outside can trigger an incidence of feline lower urinary tract disease. First, water is most important, right? You need to be feeding a water-rich and low-mineral diet of canned or homemade food, right? More than anything else. So water first, think fluid. And you're not just getting it from the tap, right? So feeding this dry, water-depleted food clearly contributes to significant urinary tract disease, right? So take this one in here. Cats consume double the amount of water when fed a water-rich diet of canned food versus dry food, right? Which is huge, double the amount of water. Right. The other thing about UTIs in general, and I think this is really true, their urinary tract infections are significantly overdiagnosed, leading to antibiotic abuse, right? So most cats have called sterile or non-infectious cystitis, right? So they get blood in the urine, they're straining to urinate. It's not likely it's bacterial, though. Crystals, too, are very commonly erroneously diagnosed and overtreated with so-called prescription diets. As Dr. Lisa Pearson says, I don't use any prescription diets other than the occasional use of canned SD temporarily. That's another big one to take in. Right, as we show here, cats in canned food have been shown to consume at least double the amount of total water, right? So, and if a cat consumes double the water, you're getting double the amount of urine flowing through the bladder. And think about that. It's going to flush everything that's in there, right? Clearly, that's the healthiest way to keep your cat's bladder flushed out and happy, right? So canned food, double the amount of water, right? Way lower incidence of urinary tract disease. The other thing is thinking about phosphorus. It's a general indicator of calcium, magnesium load in the diet. So if a diet is low in phosphorus, chances are it's also fairly low in calcium and magnesium. And these are the two minerals making up the most common type of crystal, magnesium ammonium phosphate, or struvite. Right. In general, you want to be wary about fish because fish, when you're looking at, say, a canned food with fish, it has a lot of bones. It's probably going to be fairly high in phosphorus. So that's the one canned food you should be steering clear of. If we're going to lower, especially a cat that's prone to urinary tract disease. This was an interesting slide I wanted to point out. The benefit of having a clumping litter, because then you can see, like the big clump on the far left, at least my left, is there's a normal amount of urine, right? Your cat pushes a big amount of urine, you can see it. Small little clumps, they're avoiding small amounts, right? So then you can get a gauge. If he's small little bits all throughout the litter box, you're like, okay, there's a problem. I need to check my cat. The presence of blood in the urine doesn't necessarily and typically does not mean there's an infection. Most of the time, blood means inflammation, right? And the other thing is, often these guys, when they have cystitis, they avoid the litter box, right? And that's one of the other big reasons for just being on it, right? Also, my cat's not being on the litter box. More likely has feline lower urinary tract disease than he has just, general behavior changes. And because it is painful, though, you also want to give some type of pain meds as well to your cat. Obviously, CBD is an easy one because, one, I produce it, but two, you guys can give that to your cat. And there's other veterinary ones, one called Buprenex, for example, another narcotic type pain med for cats. Okay, and the other big point here, right, is that most of the time, we're seeing up to 99% of cystitis cases in our cats are not due to bacteria, right? And too many times, right, they go in and your cat gets sent home with some type of antibiotic, right? And this is another big point, which I wasn't as much aware of, but that crystals are not thought to be a significant cause of cystitis, another common misconception both among lay people and veterinarians, right? And we're like, oh, it's crystals. Let's get on this veterinary acidifying prescription diet. And it might help treat one stone, the magnesium ammonium phosphate or struvite, but it might cause another one called calcium oxalate, right? Because you acidify the urine, you make things more alkaline, you can lead to another type of stone, right? You're moving the pH out of balance. So this is Dr. Lisa Pearson's cat. I put him up here because his name is Andrew, which is a great name, by the way. Right, there's magnesium, ammonium, and phosphorus was the predominant mineral mixture. Magnesium, ammonium, phosphate. Struvite, found in most cat urine. We're looking at crystals, we found struvite. So then we added things to that, such as D-L-methionine, made it more acidic. Like, that seems like a good idea, right? We didn't just figure out, let's just treat them with by feeding them what they should be eating, animal protein. No, we'll just add some other drug or additive to the food. We'll figure out how to treat those crystals. So the problem is that by adding in this methionine to help one problem, we've changed the pH of the urine, making it more likely they get another type of crystal called calcium oxalate. Right. Then suddenly we have more cats suffering with calcium oxalate crystals and our patients suffering with the regular struvite crystals. Right. So, and the other big point about urine pH, this is an interesting one, is that cats typically in the wild, they would normally eat a bunch of small meals throughout the day. When they do that, generally it helps keep the pH in a normal range. By us feeding our cats just one or two big meals a day, that actually that has a much bigger effect on the urine pH, making it more likely they're going to get these type of crystals, right? Which is and I never thought of that, and that makes huge sense. So in part, we've triggered it that way. We feed them, we concentrate when they get food, and we make it much more likely that it is going to be more alkaline, producing that calcium oxalate crystal. And the interesting here, like Lisa Pearson says, right, in general, I don't use prescription diets except in rare cases, right? She would temporarily use Hill's Canned SD. She knew the cat had urinary tract stones, like a urolith, an actual stone in the bladder, or large amounts of crystals with a high index and if it's more likely that they are struvite versus calcium oxalate. So first, you got your cat straining to urinate, right? First, you're going to see your vet. You want to make sure your cat's not obstructed, right? And either way, get a urinalysis done. And hopefully they're doing urinalysis properly. They're not imagining bacteria present and they're saying he's got a UTI, he's got to be on an antibiotic. At least get that done. Regardless, right? We've already gone over this 1,000 times. Fluid is most important. Additional fluid, period. Canned cat food, maybe sub-Q fluids, right? Any type of quality canned food will be helpful, not just the veterinary foods, right? Which is huge, right? We're increasing the amount of fluid going into the bowel. That's more important than anything else. And likewise, if it's primary animal protein, it's going to be a more balanced urine pH. So it's less likely your cat's going to have struvite, the crystal that's produced when the urine is too acidic, alkaline versus too acidic. Like we're going to get a balanced urine pH. You can learn how to give fluids at home. We talked about this earlier. Have your veterinarian show you what to do. In some cats, for instance, we give sub-Q fluids under the skin. That additional fluid makes its way into the bladder. When the bladder wall gets bigger and it stretches, it actually provides pain relief for your cat. And it'll flush out some of those, more often than not, it's primary red blood cells because the bladder wall is inflamed. It flushes all those excess cells out. The act of stretching, it makes your cat feel better. In some cases, that alone is therapeutic, just sub-Q fluids. That's an easy thing for you guys to learn how to do at home. And in some of the guys, we know stress is an underlying cause of these cats of FLUTD, right? So just use something like Feel Away, this natural cat pheromone, which makes your cat feel happy. You can use it as a diffuser. And some people find Bowel Rescue Remedy, one of the flower remedies, 1 drop twice a day. That makes your cat feel better, right? It's another natural anxiety relief. It is a good idea to add in additional glucosamine and chondroitin because what we're finding is these glycosamine and glycans seem to help cats that have recurrent bouts of feline lower urinary tract disease, right? Glucosamine is anti-inflammatory, can help rebuild the damaged bladder lining. Chondroitin helps prevent the wall from being broken down. Both of those are in Ultimate Feline Health formula. The lavender essential oil, I use it in one of my last old cats, Gussie. It was great to help decrease her anxiety. Right? I put 10 drops of lavender in a cup of water, diffuse that in the room. And that really helped her sleep throughout the night. And I think pee less in the house. L-theanine, it's an amino acid isolated from green tea. It's also been shown to help decrease anxiety and may be helpful for our cats that have urinary tract disease. Cat dose about 25 milligrams twice a day. Then CBD. And if you're going to pick one treatment for a cat that has urinary tract disease, aside from like the right type of food and all that additional fluid, is CBD. Because one, it can decrease inflammation, right? You're adding in the drop of CBD under your cat's mouth, it'll go and concentrate in the bladder, decreasing inflammation. And two, it can also help decrease their anxiety because we think in many of these cats, that's the underlying trigger is anxiety, right? So 1 drop a day, my supplement, maybe all you need. And I've had many cat parents say that really made a big difference for them. So a bit about supplement safety. Here's how to know if supplements are safe for your cat. In light of the recurring pet-free recalls, etc., super important, right? As a consumer, it's difficult to know. There is a voluntary governing body called the NASC, but there is no independent regulator. So you need to do some of your own research. Research the company. Can you phone them? Do they do independent third-party testing? And this means getting the product tested prior to leaving the plant. Is there a guarantee that what's written on the label is in the bottle? Are they manufacturing to human grade standards? Are the ingredients from top quality, reputable suppliers, locally sourced as much as possible? And just look for references from other pet parents. All right, so here's our website, thecatsupplement.com. You can phone us at 888-842-9057. Our supplement is third-party tested by an independent lab, and we guarantee that what is on the label is in the bottle. Right. It's manufactured to human-grade standards. The ingredients are from some of the most highly reputable quality suppliers in the industry, primarily sourced locally. And for today, we're having a special of 70% off Ultimate Feline, no strings attached, no ongoing payments being offered for only $9.97. The regular price is $32.97 plus shipping, and you're not locked into anything. It's a great time to try Ultimate Feline. Plus, we have our new Ultimate Feline economy size. The thing with the economy size, it gives you a 6-month supply for one cat. And the special pricing for today's webinar is $79.97. That's a 60% discount compared to the regular jar pricing. And plus, if you order in the next 12 hours, you can get 2 additional free bonuses. First, a digital copy of my best-selling book, Veterinary Secrets, Natural Health for Dogs and Cats, plus a copy of my book, Home Diets for Pets. So after the presentation, you can go to thecatsupplement.com/special. A bit about IBD. We're doing pretty well, you guys. Thanks for being on the presentation. Or chronic diarrhea in our cats. Well, that's a poor kitty getting ultrasound. It doesn't look super happy. It's an inflammatory disease of the intestines. We don't know for sure the cause. But we suspect there can be an allergic reaction or hypersensitivity against food and or bacteria that are suggested as the cause. Clinical signs: chronic vomiting, diarrhea with weight loss. Super frustrating, right? So what are some of the bases of treatment? We're always starting with a dietary therapy, a novel protein or a hydrolyzed protein. So this would be one of the cases where I would have you encourage you to try one of the specific veterinary ones, like the hydrolyzed protein diet. But you need to start it with a really focused, like minimum 6-week trial, a specific diet. And that's all your cat gets for that 6-week period of time. Adding in the beneficial bacteria, like really focusing on some of the good quality probiotics, such as what is in Ultimate Feline. Right? Using antidiarrheals as needed, right? Some people find, especially short-term, Imodium is fine, or loperamide. And then also considering some of the natural immunosuppressives, right? So we have one such as cannabidiol, may be beneficial in this case. Licorice root short-term is a good one to consider, right? Conventionally, they're using immunosuppressives such as prednisone or some of the stronger immunosuppressive drugs. And if you're using licorice root, you're earning a 1/4 ml per 10 pounds of body weight twice daily, somewhere between 7 and the maximum of 14 days. And lastly, really consider slippery elm, right? We've talked about it earlier, just because we talked about it for cats that are constipated. But the big thing about slippery elm, it's going to coat the intestinal tract. It's going to form this almost like gelatin-like covering of the intestinal tract, naturally decreasing inflammation. A standard cat dose, about 400 milligram capsule once a day. But you can just break open the powder, mix it into your cat's canned food if he'll eat it that way. And many of the cats with IBD respond really well to slippery elm. Cancer in your cats, what are some of the things you can do to help? I want to mention a couple of big things. Like here's a cat that has feline fibrosarcoma, that vaccine-induced type of skin cancer. Obviously, antioxidants. Oh, oops, what happened there? Oh, sorry, I just skipped away a slide. They've been shown to decrease cancer likelihood. In some cases, may help slow the growth and spread of some of the cancers, right? So vitamin E, selenium, astaxanthin, vitamin C. Some of these antioxidant vitamins. The omega-3 fatty acids, in general, I recommend for any of the cancers, period. 500 milligrams daily of the krill oil supplement, for instance. As I drink my dandelion concoction here, talk about dandelion root. So I've got a video on YouTube shows you how to make it. Essentially, you're taking concentrated dried dandelion root, and there's been a number of different studies showing the specific benefits of what is in dandelion root, how it is helping for many of the cancers. So if you were to make it the way I suggest on YouTube, you'd be dosing your cat at about a teaspoon twice a day of the dandelion root tea tincture. 95% curcumin, and this is part of even Joe Timpin's cancer protocol. Because there's a bunch of studies, not for every type of cancer, but for some of the cancers, such as colon cancer, showing a clear benefit if you're on 95% curcumin. Doses of about 100 milligram per 10 pounds of body weight daily. It's kind of standard cat dose. CBD, and I ideally you've got CBD in combination with THC, so 4 parts CBD, 1 part THC. Array of different studies showing clear benefits of the cannabinoids, CBD as well as THC. How in some cases they can decrease the likelihood of the cancer cell spreading. Other cases they bind to the cancer itself, allowing the immune system to then recognize the cancer. Some cases they actually encourage and actually help cause cancer cell death called apoptosis. That fenbendazole or Panacur for cancer, we know it's been shown to help some people. And we've also seen, like, especially in the dogs, I haven't seen as much reports in some of the cats of being beneficial for cancer. But if I were to have a cat with cancer again, I would definitely try it. I use it for many, many cats in practice as a dewormer, especially if we're also trying to rule out things like Giardia. And it's even if you had a cat that had inflammatory bowel disease, chronic diarrhea, often I would use fenbendazole just to make sure that we're not dealing with some type of unknown parasite. So it's very safe. Here's one potential regimen to use it. We're using it at a really high dose of 50 mg per kilo once a day for 3 days on, 4 days off, and repeating that for a month, and then assess whether it's being beneficial to your cat or not. But it could, it may not, but it may be beneficial. And it's sort of one of the things. Might be a really big upside, no real downside. So it's definitely worth trying. Melatonin for cancer, especially some of the hormone type related cancers, i.e. say a cat that had mammary cancer, for instance, I would consider melatonin. Right. And what they find is it works in conjunction, say, with chemotherapy drugs. And we're not really clear. We know it's a pretty potent antioxidant as well. So maybe it's then affecting the cancer cells that way. But regardless, it's beneficial for many of the cancers. A typical dose, about 2 milligrams per 10 pounds of body weight daily. Some of the medicinal mushrooms. I wanted to mention turkey tail mushroom. For instance, in Japan now, it is actually classified as a therapeutic regimen for people that have some of the cancers. Like, it's got so much research behind it. Yet it's virtually unknown here in North America. I don't totally understand why, but it is. So it's got certain things in it called polysaccharopeptides, PSPs, which have been proven to delay the growth of cancerous tumors and help improve survival rate. Standard dose about 10 milligrams per pound once or twice daily. So about 100 milligrams once or twice a day. I have a cat with cancer. He'll definitely be on turkey tail mushroom. And then I wanted to mention some of the other immune supportive supplements. Because we know if you're going to be treating cancer, it needs to be multifactorial. So you're trying to use things like probiotics, antioxidants, zinc, colostrum, immune supportive mushrooms, aloe vera. And many of these are in Ultimate Feline Health Formula. I love that slide. Home diets for cats. So I'm not going to go through all these points. Just want to add in a couple big things. Focus on the protein. Chicken, turkey, or duck are ideal for cats. No carbs. You need to add in, if you're making a homemade cat food, an additional balanced fat. I like sunflower oil, an additional omega-3 fatty acid supplement, such as the form of krill. Right? You need to add in additional calcium. This is if we're going to make a balanced cat food diet. I prefer ground eggshells. You can dry them, roast them, or you can just add in something like the eggshell that we talked about. Vitamin D is needed, but there is vitamin D in the fish oil and the krill oil. Vitamin E is also needed, but it's in sunflower oil, which we're adding. Iron is in the animal protein. It's pretty critical for your cat's diet. Zinc is in the meat, often in flax if we're using that, because when we're using it as additional fiber. Then we're adding in an amino acid taurine, because that's a key important amino acid in every cat's food period. They need to have additional taurine, and as well as additional calcium. In some cases, ground flax is added just to add in additional fiber. So I just want to show you, here's like a quick one. You guys are going to get a copy of this, so you can refer back to it. We've got 1 pound of ground turkey, an optional egg, a tablespoon of sunflower oil, the krill oil, some light salt, which is additional potassium, iodinated salt, so salt with iodine, calcium carbonate, or half a teaspoon of ground eggshell, right? A scoop of Ultimate Feline to make a multivitamin mineral supplement, as well as additional taurine, 1 500 milligram tablet or 1/4 teaspoon. So here's a ground turkey diet for cats, and there it is. It's balanced. It can have all the vitamins, minerals, nutrients your cat needs to thrive. And it's relatively simple to make. And I know when I made it, my cat was really happy eating it. You just saute the turkey and the egg till it's well cooked. I added in the ground eggshell along with the ultimate feline and drizzled on the krill oil and the taurine. And the average cat's going to eat about a third of a cup, well packed twice a day. Right. And that recipe makes about a cup. A little bit more about feeding cats, and here's what you need to know. We're highlighting some of the things we almost talked about more than anything. And we've already talked about this at the start of the presentation, but much of what I was, as a practicing veterinarian, was originally taught about feeding cats, both for the prevention and treatment of disease, has been shown to be false. Cats are not small dogs. They're obligate carnivores. They need animal protein to survive. We didn't learn that. And many of the common cat diseases are directly linked to our incorrect assumption of feeding cats the same way we feed dogs. Right? They've evolved over millions of years, how they hunt. Right? It didn't just happen one day. Oh, we learned about dog nutrition. Let's just apply it to cats. They're completely different animals. Thinking about what a cat would eat in the wild: lots of protein, fair amount of fat, virtually no carbohydrates, right? And that's what we should be using in nutrition, what we're not. They need so much more protein, nearly 30% protein in their diet versus the adult canine minimum requirement of 12%. Right? They evolved as animals with very poor triggers for thirst, right? They're not accustomed to having to drink water because they're eating dry kibble. That's not what they would eat in the wild. Canned food, much more close to their more natural diet. Is that we provide 60 to 70% of the water that they need versus the no water that's in dry kibble. They're adapted to eating multiple small meals throughout the day, right? A cat in the wild might eat up to 20 meals a day, and that makes sense. In part, when we're talking about, crystals that form based on the urine pH. In that, if we're actually, and in part, that's why cats in the wild wouldn't necessarily have crystals, because they're eating multiple small meals throughout the day. They're not gorging on their food once a day that spikes the urine pH, leading to crystals. They're very sensitive to the feel, the smell, and the taste of the food, right? They're just very different, right? So here are some of the foods I would have you look at, and by no means it's complete. And there's ones that I've had experience with, right? Artemis, Asmira, Back to Basics, Candy Day, Champion Pet Foods, First Mate, Flint River Ranch, Fresh Pet, Halo, Holistic Blend, Honest Kitchen, Instinct, Life's Abundant, Nature Pet Products, Nature's Logic, and that was listed on Susan Dixon's The List of Best Pet Foods. Nature's Variety, Open Farm, Pet Curing, Pet Nutrition, Solid Gold, Timberwolf Organics, versus Beyond Wellness and Wisong. But about diabetes in cats, the cause and the surprising natural cure. Yes, and there's Murray looking very regal. So here's where the pancreas is located. You sort of see tucked into the small intestine, right? Up here in next to the liver. So what the pancreas, in part what it's doing and how we explain it and relate it to diabetes, it's producing insulin, the hormone, which is supposed to tell the cells to take up sugar, right? So there's two different types of diabetes. I think we're going to mention that. Type 1, the pancreas doesn't produce enough insulin. Not enough insulin, the cells can't take up blood sugar. Or type 2, related to diet, where I'm not sure if I have a slide on that. No. Or type 2, related to diet, where the cells are no longer responding to the insulin. Right? So we've been feeding our cats these high carbohydrate meals, asking your cat one to metabolize those carbohydrates, deal with this spike in blood sugar. Another one, they can't produce enough insulin, and the cells stop responding to the insulin that's present, right? Subsequently, we're turning our cat into diabetic. Most of the time, most cats are considered type 2 diabetic. Excuse me, where much the same way that people are, right? Where, it's diet induced. First, you suspect your cat is diabetic. He's drinking more often, urinating more, middle-aged cat, losing a bit of weight. You're going to go to your vet. You're going to do appropriate blood tests, probably confirm, yep, your cat's a diabetic, right? Most cats have to start with insulin, right? Virtually all. By the time they get to the vet, probably need to start an insulin. Some do better on Lantus, for instance. but your vet can talk to you about the different options. Once you get them regulated, so now we get our cat regulated, and then we're going to start with diet. Changing to a less than 5% carbohydrate, high protein food is the single most important change to make. You're eliminating the dry kibble, only feeding canned, homemade, or raw. Now, some of these include wellness, even if fancy feast chunky chicken as an option is better than some of the other stuff versus the dry kibble. Obviously, there's much better ones such as Nature's Variety Organic, the raw frozen foods. But by doing that, getting off the dry kibble, increasing all the animal protein, they're finding upwards, and I found upwards of 50%, probably even higher, can come off of insulin, right? Just by feeding that high protein, canned, homemade, raw food diet. Such a big percent respond. We want to add in additional omega-3 fatty acids, in particular krill, right? 500 milligrams daily, right? And that seems to help increase insulin sensitivity, meaning the cells are more likely to respond to insulin, and then your type 2 diabetic cat is less likely to be type 2 diabetic. CBD. One, we know that there's an inflammatory basis, so CBD can decrease, at least that's what's partly with thought. There's inflammation, the immune system, or something's attacking the pancreas. It can't produce insulin. Okay, CBD may decrease inflammation, help in that case. Secondary, there's research showing CBD has promise of reducing insulin resistance, right? So the insulin is being produced, but the cells aren't necessarily responding. So I wondered, I would suspect too, it's also probably got some inflammation slash immune modulating benefit there. That then means the cells are no longer as inflamed as they were, and now they can start to respond to the insulin that's present. It's just a good idea to give. Or you've got a diabetic cat, try them on CBD. 1 drop per day of my CBD supplement, or 1 drop twice a day. We're completely fine. A coenzyme Q10, it's a compound found naturally occurring all throughout the body, especially in areas with high oxygen demand, right? Such as the heart, such as the gums. Clinical trials using coenzyme Q10 suggest that supplementation may significantly lower blood sugar levels, right? So it's a pretty inexpensive supplement, a pretty small dose for our cats, 20 milligrams per 10 pounds of body weight daily. Chromium, and many of even the specific diabetic cat diets have added in additional chromium because there's been a bunch of research pointing towards the benefits of chromium, right? Right. So double-blind studies have shown that supplemental chromium can raise glucose tolerance in patients with both type 1 and type 2 diabetes. Yeah, so it can help decrease insulin levels, right? Lower fasting sugar levels. A simple way is just adding in brewer's yeast. Get brewer's yeast, mix that into your cat's food. 1 teaspoon a day, right? You don't need to get like specific chromium tablets. Get some brewer's yeast. Other supplements may be beneficial. Probiotics have been helped to show lower levels of inflammation. They may be beneficial for our cats who have diabetes. Colostrum, right, has been studied for its benefits in increasing metabolic rate, especially like these athletes like to take colostrum, helps them increase muscle mass. And so that may be beneficial for diabetes. Right, here's one study showing lactobacillus may improve glucose tolerance. In animal studies, another one showed how colostrum has helped the ability to maintain balanced blood sugar levels and can have a significant impact on people with diabetes. Right? Both probiotics and colostrum are in my supplement Ultimate Feline Health Formula. A bit more about my supplement Ultimate Feline Health Formula. Well, does it work? Well, that's a good question. And you should know what's in it before you think of giving it to your cat. I have a complete vitamin and mineral blend of 25 different nutrients, including antioxidants. This one review is the effect of nutritional interventions on the longevity of senior cats. And results from the study suggest that a diet supplemented with a combination of antioxidants, prebiotics, and long-chain polyunsaturated fatty acids can increase the lifespan in senior cats. It just makes sense to me. I have a joint support blend, therapeutic levels of 3 key nutrients: glucosamine, chondroitin, and MSM. This came from JAVMA, compelling evidence that glucosamine and chondroitin may interfere with the progression of osteoarthritis. Great way to naturally help your arthritic cat. Or this one was talking about idiopathic or feline lower urinary tract disease, and said that oral glucosamine supplementation has few side effects and long-term therapy may be useful with other therapies in cats with feline lower urinary tract disease. So it makes sense to supplement with it, especially a cat with urinary tract disease. I have additional prebiotics that helps the good bacteria, the probiotics, grow, as well as an array of different probiotics, Lactobacillus acidophilus, Lactobacillus bifidum. Here, this one with chronic diarrhea, right? And they just show like probiotics play a role in improving immune response, replenishing normal GI microflora, and hastening the resolution of diarrhea, right? So like, here are scientists saying like this is being beneficial. And sort of like, why wouldn't you use the probiotics? I also have a key immunoprotective blend, including colostrum, inositol, aloe vera, and the mushroom I take. And this one review study from actually came from the Canadian Vet Journal. So the colostrum used as a nutraceutical treatment for animals of all ages. It's been shown to help increase resistance to infection and disease caused by a wide range of pathogens, as well as help heal intestinal lesions. Like, it makes huge sense to use colostrum. So a bit more about my supplement, Ultimate Feline. Does it work? No question. This is best answered by the over 10,000 cat owners who have used Ultimate Feline Health Formula. Right? Carol said, my cats all had such silky fur. It was incredible. After about 4 days after I started using the cat supplements, my cats all had such silky fur. It was incredible, which is awesome. Thanks, Carol. Right? Or Nancy said, after about 7 days or so on the supplement, his sneezing and nasal discharge stopped almost completely, which is awesome. Right? As you know, I ordered a jar some time ago, used it for my cat with serious upper respiratory problems. At the time she started, he needed an antibiotic. After about 7 days or so on the supplement, his sneezing and nasal discharge stopped almost completely, which is awesome. Thanks, Nancy. Right? Marge says he jumps up on the porch banister railing him and starts to chase the other cats. Right. After trying the supplement, I was surprised to see our 5-year-old Scotty, our heaviest cat, orange and white. She did send a picture. Jump up on the porch banister and start to chase the other cats. Wow, big change. And then their 10-year-old Tabby was a lap cat, jumped up on my lap, and she noticed that his skin was so much better. No dried flakes or dandruff. Which is awesome. Thanks, Dr. Jones. Keep up the good work. Thanks, Marge. Cynthia said, cats are eating better, have much more energy, you're not getting hairballs or vomiting, right? It's great. And like she said, it's great to see them feeling so energetic and healthy. I will definitely be back to order more. Thanks, Cynthia. Right. Near Sanders said, the supplement has literally been a lifesaver for my cat, right? She's 16, was in the early stages of renal failure, right? She never liked canned food, right? She tolerated the renal diet, didn't want to eat it. Then all of a sudden she gets the supplement, adds the supplement to the canned food, and now she's eating like gusto, which is awesome. So please tell Andrew that he's now officially my hero. That's awesome. Thanks, Sandra. It's nice to know that I'm somebody's hero. So thank you guys for attending today's webinar. I hope you found it helpful for both you and your cat. Wow. And guess what? We finished with 1 minute to spare. It is now 6:29. A bit more about my supplement and my special. Right, we're having 70% off of Ultimate Feline, no strings attached, no ongoing payments. You can get it for $9.97, the regular price being $32.97 plus shipping. Plus, you're not locked into anything. We also have our economy size, which gives you a 6-month supply for one cat, like 180 servings, which is awesome. For the special, we're having it's priced at $79.97, which is 60% discount compared to the regular jar pricing, which is huge. It was a great time if you got a bunch of cats and you want to get a whole bunch of the economy size. And plus, if you order in the next 12 hours, you can get 2 additional free bonuses: a digital copy of my best-selling book, Veterinary Secrets, Natural Health for Dogs and Cats, plus a copy of my book, Home Diets for Pets. Okay. So now we're finished. Hooray! You can go to thecatsupplement.com/special. So thanks, you guys. Man, that was a lot of information. Sorry, I didn't mean to overwhelm you. In between there, I was So, the other big thing my brother wants to say is for me to mention that, yes, the supplement is now in stock and you guys can order it. So there's no back orders of anything else. So yes, you can go to thecatsupplement.com/special and there will be as much supplement as you would like to have is all there. I know we had a big issue there with our supplement manufacturer and then not able to get certain ingredients, and we're not sure all the specific reasons why, but finally we got the ingredients. We went through all the quality control, finally happy with everything that was in it, and it was the way it should be. So yes, the cat supplement is now in stock, which is going to make many people happy, including myself. Okay, so first, thanks for being on the presentation. And I'm sure, and I see a bunch of people have probably a bunch of questions. Unfortunately, I'm right at the end because it's now 6:31. I'm just seeing my. So what I am gonna do, because I'm sure a bunch of you guys have questions, I'm gonna put in. Where is it here? I'm gonna put in my email. So for those of you who have specific questions, ideally relating to the webinar, but if it's just relating to a question around your cat's health and or the supplement, feel free to ask them. So I'm going to put my email and I'll be answering those in the next few days. So today's Tuesday. I'll be answering all those by Friday. So my email is, so it's Dr. Andrew. The email is Dr. Andrew at thecatsupplement.com. There it is. Ta-da! So that's just for you guys. So it's Dr. Andrew at thecatsupplement.com. And then for those of you who have specific questions about the webinar, about your cat, about the supplement, feel free to fire me off an email. But yeah, thanks for being on the presentation. I hope you found it helpful. So it all is being recorded, so you guys can all refer back to stuff too. So you don't feel the need like, oh, I missed that. I want to know that information. Say your cat has chronic CKD, you've got a cat that's got lower urinary tract disease, like, oh, what about this? What about this here, this treatment here? So then you can actually refer back to some of that. Or you've got a cat with IBD, for instance. So thanks, you guys. So once again, so thanks. And I see there's a whole bunch of many people saying thank you. And thanks for all you guys for being on the presentation. So as I said, and then we'll be getting the recording. So it should be out in a few days. If we get it recorded and a little bit of editing. I know we're also doing a follow-up presentation on noon on Thursday too. So if you're at all interested and you want to see me speak again for an hour and a half in a rapid fashion, that would be again. So that'd be this Thursday at noon Pacific as well. We're doing the follow-up. I think it's noon. I'm pretty sure it is. But I'll be sending out an email clarifying that as well too. So once again, thanks for being on the presentation. And I'll be talking to you soon. Be in a day and a half, or it could be in another month. And it's Dr. Jones.